An illness that we highlighted in this week's What's Going Around report is making a widespread sweep in Kentucky, and it can be a scary one. So to help parents prepare, U of L pediatrician Dr. Mike Howard is with us to talk about croup. This is a scary sounding cough.
Well, it is indeed, Lori. It's an upper respiratory tract infection caused by a virus that we typically see in the fall. And where the symptomatology occurs is some swelling in the trachea, the windpipe up near the larynx. And that's where we get these unique symptoms. You've heard the classic barky cough like a seal. That comes from the fact that it's near the larynx, the vocal cords.
And there's swelling there, right?
Yes, there is.
So can a child actually struggle to breathe with this?
Oh, most definitely. They get what's called stridor, where they make that noise as they take a breath in, and that can be quite frightening.
Now, who's most at risk with this?
We see it very commonly in the age group from about 6 months all the way up to 3 to 5. It's rare to see it in older children or adults.
And the younger children are, I guess, more at risk for serious symptoms?
Yes, because their trachea or windpipe the diameter is narrower, so the swelling causes a smaller opening there.
Well, when you hear that baby struggling to breathe, I've actually taken my little one to the ER over this in the middle of the night. How do you know as a parent when it is serious enough that you rush them out the door and get to the doctor?
That's a very good question. You want to look at the child's actual respirations and look towards their rib cage and see if they're pulling in or retracting, as we call it. Also look right above in what we call the substernal notch here. And if that is pulling in, then that can be a cause for alarm too. And they should be evaluated in an emergency room because there is treatment obviously for this in the form of corticosteroids.
Otherwise, maybe just call your doctor and tell them that your child has this going on. And
yes, it's never a bad idea to touch base with your primary care physician. They can give you some insight about whether the child needs to be seen, how quickly.
And I understand that maybe cough medicine doesn't really help with this because it's upper respiratory.
Right, cough medicine isn't going to do anything.
All right, Dr. Mike Howard, thank you so much for being with us and some good advice for parents if you're faced with this, especially at 2 in the morning, to know what to do. For more information, go to my health page at wave3.com. We'll have all the symptoms for you there, and as well as Dr. Howard's contact information. So thanks again for coming in.
My pleasure.
Sure.
Working for you.